Hi, I'm Jake Duncan, functional medicine practitioner, stewarding life wellness. I wanted to make a short video to go along with a blog I'm going to publish today about vitamin D deficiencies, the dangers of supplementing with vitamin D supplements, and particularly focus on magnesium deficiencies. So, vitamin D deficiencies are a big topic, and if you look online, most people are deficient, and if you test yourself, you're probably deficient, and it's a good thing to know. But the question is, do you need a vitamin D supplement, and is there potential harm from just supplementing with vitamin D if that's all you know that is going on? The reason why that's an important topic is vitamin D deficiencies have been linked to cancers, worsening prognosis with cancers. It's been linked to heart disease, brain-related symptoms, ADD, ADHD. Let's look on here: mood disorders, depression, schizophrenia, Alzheimer's, dementia, heart disease. May even worsen autoimmune processes like MS and psoriatic arthritis, and neuromuscular disorders like Parkinson's. Weakened immune system, chronic respiratory infections, risk of getting the flu or other viral infections, potential bone weakening, osteopenia, osteoporosis, or potential fractures in the elderly. With all of these benefits of good vitamin D levels, then how could supplementing vitamin D potentially be harmful is a good question to ask. And the reason why is because vitamin D plays, it's not only a vitamin, it's a hormone, but it has a delicate balance that goes on in the body with multiple things, but particularly with the minerals, calcium, potassium, and magnesium. And so vitamin D itself, one of the main things it does is it pulls calcium into the blood. Potentially, if there's too much of that, and then things are out of balance, it can potentially cause hypercalcemia, too much calcium in the blood, and hypercalciuria as well, where there's too much calcium in the urine, which can lead to kidney stones, a relatively common cause of kidney stones. If that balance is off, that can happen. In addition, if there's an imbalance in these other minerals, too much vitamin D supplementation could also pull too much calcium out of the bones into the bloodstream and actually lead to an osteopenia, osteoporosis, and again, life-threatening fractures in the elderly is kind of one of the most common concerns with that happening. So with that, the big question to ask is, again, how could that happen, and why would it be dangerous to supplement? And the main cause is if you supplement with vitamin D to get these potential benefits that I listed earlier, but you have an underlying magnesium deficiency, that could cause a host of problems. So because it will further deplete your magnesium levels. So your magnesium will get even lower if you supplement vitamin D with an underlying deficiency in magnesium. So how do you know if you have a magnesium deficiency? Sometimes symptoms can tell you, but usually you want to confirm that with a lab test. So a magnesium RBC level is what you want to request. If you're seeing me, then we're gonna look at your magnesium level. It's going to be in either the ion test that we run, or we're going to get it drawn through LabCorp request. Symptoms. So symptoms are at best a distraction, is a functional medicine motto. But if you have a host of these symptoms, it might be pointing to a magnesium deficiency. So high blood pressure, preeclampsia, eclampsia, and pregnancy, anxiety, panic, headaches, constipation, dizziness, vertigo could come from magnesium deficiency. Restless leg syndrome, super common. Back pain, fatigue, brain fog, ADD, ADHD, epilepsy, and seizures will be potentially, that could be the root cause, but definitely worsened if there's an underlying magnesium deficiency. It could cause an underlying vitamin D deficiency. So if you supplement with a bunch of vitamin D and your levels are not coming back into normal range, then that's probably an underlying magnesium deficiency. And so that's possibly just worsening your magnesium level while you're supplementing with that. Heart rhythm issues, so arrhythmias, muscle cramps, facial twitches common, food cravings, sugar, carbs, blood clots. The blood does clots easier without a good magnesium level. PMS, so especially painful cramps and heavy bleeding. The reason why is because magnesium is what helps the muscles to relax after they contract. Calcium helps them contract, magnesium helps them relax. So magnesium is kind of nature's relaxant to the body. A lot of people use it to sleep because it kind of calms things down. It doesn't make you drowsy, but it just helps the body calm down. So the uterus being a muscle, a very common way that can cause worsening cramps. If that's imbalance with your calcium levels, that's going to be in a very volatile place that's just gonna hurt more, and you typically will bleed more too because of that. So again, a lot of symptoms, and probably several, you could probably see several of those in yourself. And so check yourself, though. It's still important to do a magnesium RBC level. If you're not here and you can't come see me for me to check that for you, then go to requestatest.com, or you can ask your provider. Ask them to draw a magnesium RBC, not a serum magnesium, and magnesium RBC. You want to know what's inside the cell, not what's in the serum. The serum magnesium will be normal unless you're like in cardiac arrest or chronic kidney failure, or you're in an ICU unit on your deathbed. Then your magnesium in your serum might look abnormal, but typically that's going to look normal. That's preserved very closely, but it can look normal even when you're deficient. So that's important. You want to know what's inside the cell. If you're less than 6, you're deficient. So the experts in this field say don't look at the lab range because that's too wide. If you're less than 6, you're deficient and you need supplementation. We run an ion test, which is a really cool test, and that's it has your magnesium, all your intracellular minerals, and it also has a full organic acid test, so mitochondrial function, neurotransmitter metabolism, B vitamins, methylation status, oxidative stress markers, heavy metal markers, fatty acid ratios. It's a ridiculously cool test, and that's one that I wish I could run on every single person I know. So another big question is, why are so many people deficient in magnesium? And there's two main reasons. There's probably more than this, but these are the two main ones, maybe three. The ground is depleted. We don't farm the soil well anymore, so should be rotating crops. We should be replenishing the soil, remineralizing the soil. We don't do that well anymore in general, unless you're part of a community agricultural group, CSA type of thing, where someone is doing a really good job of that. Your food will have good magnesium content, but for most of us who have to spend a lot of time shopping at grocery stores, even organic is going to be depleted typically in your minerals. So it's depleted in the soil, and then you burn through it faster when you're under stress. So again, that's most everybody I know has too much stress on their plate. So, and then maybe the third reason is, and this is kind of linked to the second reason, when you're under stress, you burn through it faster. Your stomach acid also gets diminished because your body's in a stress response. It's taking emphasis away from digestion and putting it towards the muscles, and so you can run faster, jump higher, even though you don't need to, just because you're under chronic stress, not trying to survive stress. But your stomach acid will be depleted, and you don't absorb things like iron and your minerals very well without stomach acid. So 3 reasons, I guess. So how do you replenish your intracellular magnesium levels? And that's kind of where the tricky part comes in. And the best answer is it's going to be individualized. We use a combination of oral supplementation, and we use topical. For most people, transdermal through the skin magnesium supplementation is one of the best ways to get it in. And I used to recommend a lot of Epsom salts, and I still do. I think they're good, but really the studies point more to transdermal oils being kind of the main and best way to do that. The trouble is they're kind of uncomfortable. They kind of tingle, but usually you get all the absorption by about 30 minutes of having them on, so you can go wash them off if you're uncomfortable from that. We use a product called Jigsaw Magnesium with SRT, which is an oral form of magnesium. Before I lie to you about the form of that, yeah, dimagnesium malate. So that's the Jigsaw that we carry. Jigsaw with SRT, phenomenal product. I also recommend Ancient Minerals. They have the topical oils. We don't carry those yet, but we probably will in the future. Remag is a great form. The author of the Magnesium Miracle, Dr. Carolyn Dean, I think is her name. She formulated this ionized form of magnesium that she loves, that a lot of people have gotten benefit from as well. Remag, we don't carry that one yet, but we might do that in the future as well. Just depends. So again, Jigsaw or oral and transdermal is the best combination for you to do that, and it takes time, sometimes months, sometimes a year, to replenish your intracellular levels if you're low enough. So all that said, this is an important topic. Don't blindly supplement vitamin D. That can be very dangerous. If you're vitamin D deficient, you need to get that level up. Step 1 is get outside more. 30 minutes of sun exposure short sleeve and shorts at the least. You might want to expose more of that if you can get outside with your shirt off, guys, in a bathing suit, females, to get more sunshine. That's the best way to get your vitamin D levels up. But again, if you have an underlying magnesium deficiency, it's going to be difficult to get your vitamin D levels up, and sometimes you do need to supplement vitamin D. But really start by checking a magnesium RBC and seeing where your levels are, and then working with someone or chatting with us about getting those magnesium levels back up and rechecking them and making sure they're coming back into an optimal range of around 6.5. So big topic. This is longer than I wanted it to be, but my blog will kind of have some of this. It'll probably have pretty much all of this in it if you need to reference that in the future. But it is a very, very, very important topic, and the symptoms of magnesium deficiency are way more than, and the dangers of a magnesium deficiency are even way more than I mentioned in this short video. So have a great day. Thanks for watching, and contact us with any questions.